welcome to Let's Talk Business. Thank you again, of course, for your patronage and tuning in. We truly appreciate it. Tonight, we are going to talk, we have a special guest. We're going to talk about the trends in medicine, specifically in medical and practices, plus the factors to consider when it comes to deciding to open a solo practice versus joining a medical group. So the big question, when a student completes his residency, what now? Of course, there's three choices that I know of. There might be more. One, do a fellowship. Some are interested in learning more about their sub practice. Do a board certification. Some choose to get board certification in their specialty after completing the residency. And then the third, of course, just the most common one, let's make some money. Let's start practice. But of course, now you have another choice. Do I start a solo practice or do I join a medical? Now, what I wanted to do was really bring in an expert, talk about this, because of course, somebody who's in the field, who's been in the field for a long time will have more general info on this. So we're going to change things up. We are going to bring our guest. We have a very special guest tonight. He will be able to give us perspective on the subject. I am very proud to have the Chief of Allergy of Optum Health Nevada. He also owned his own practice for over 20 years. He is my mentor and my big brother. Please welcome Dr. Rick Vinoya. Good evening, doctor. How are you doing?
Hi, Sonny, and hello to your listeners. Thank you for the generous introduction. And it's literally your brother, right?
Oh yeah, literally my brother. Hey, of course, I can tell the audience all about you. I mean, I've been following you around since your days in UP Med, but please tell the audience, tell the audience about yourself.
Sure. I can, well, being an immigrant, I share with you my immigrant journey. I went
Mm-hmm.
to the College of Medicine at the University of Philippines in Manila. And I was almost I almost started residency when I had to leave and go to the United States because of unforeseen circumstances with the family. When my mom got sick and our mom got sick. And when I came here, I started off my journey here in the United States by doing a fellowship at Duke University. And then I went into residency at Detroit Medical Center, Wayne State University. I did allergy and immunology, first pediatrics and then allergy immunology. And then I stayed on, I was offered a stint as chief of asthma services at Children's Hospital of Michigan, which is an academic hospital. Stayed there for a few years. Then I went with a private practice group, with a three-man private practice group affiliated with the University of Michigan. And then from then I branched into my own private practice. And after 20 something years, I moved from Michigan to Vegas, mainly to be with family, of course. And here I am with Optum. I've been with Optum Health Services for the past 2 years, and I've been chief of allergy over the past 6 months. So here I am. So as you can see, I've been around. I've been in academia, I've been a three-man group, and I've been a solo practice, and I'm now in a physician group owned by a health insurer. So that gives you a whole gamut of things.
That's the reason why I wanted you to be on, because it really gives you've seen every part of this. So for a doctor that just finished his residency, either here or from the Philippines coming here as an immigrant, what are some of the factors involved in deciding if they should open a practice or join a medical group?
It's so funny because when you asked me this question, I look back at my days and I first came here after I finished my residency. It's the exact same question I asked myself. And as you said, there's people coming here from the Philippines who just finished their residency, but they have to repeat the residencies here. And there's people who actually graduated from American colleges. But the question is still the same, but with some differences, because in terms of student loans, of course, the people who went to school here would have bigger student loans, I would assume. So let's start off with general principles of how to choose. You have to really take into account your personality. Just face yourself in the mirror and say, what kind of a person am I? So the person who usually starts off her own practice or join a private practice is more business oriented. Okay, so you have to be versed not only with medicine, but you have to like or the business of medicine. You have to tackle IT, you have to tackle HR, you have to tackle contractual negotiations, you have to tackle staffing and everything that comes with running a business. If your personality is more like, I just want to see patients, I just want to practice medicine and get a good base pay, then you would prefer to be in an employer group. The secondly is age, and we'll talk about that in a second, okay? And then third is career goals. So if your career, if you want to advance, you want to be a hospital administrator, you want to be in organization, then of course don't go into practice. The only career goal you have in practice is if you're joining a burger practice, if you're going to be the partner or if you want to buy out the practice later on. And then there's of course your expectations of salaries. If you have student loans, of course you would like to have a more stable base pay, then the safer route is to go to an employed practice group, okay? An employed practice model. And salary in private practice is more variable depending on the reimbursements and how paying patients, the volume, and of course the bonuses that you have depending if the private practice group has other assets. And there's also bonuses on the employment side, but they're more fixed. So those, and then finally, it's the practice characteristics. So if you join a practice or you set up your own practice, you can set the culture, the practice culture. And if you're joining a private practice, if you believe in their private practice culture, then you can thrive in it. Whereas in a hospital, it's a little bit different because the hospital kind of dictates the culture. Okay, so you don't really have autonomy. But what in exchange you have a guaranteed referral base, so you don't have to market yourself as much. The hospital will market for you, okay? And then in terms of course, the administration headaches, you won't have that, and you'll have more vacation time. So there's a lot of pros and cons, and there's a lot more layers to the onion on this as we discuss this further. But those are some general principles.
Love that you mentioned culture because I've been preaching that on the show. Culture is so important. And see, even medical practice have culture. Before we dig into more on the generational difference, I want to ask you about shortages. We have a growing shortage of physicians nationwide, definitely here in Nevada. Can you tell our audience, in your opinion, what are some of the factors that are contributing to the shortage of physicians?
There's been a shortage of physicians even before COVID, but it's really just been accelerated by COVID. And there are several reasons for this. The number one is the aging population. And as the population ages and you have an increased population growth, okay, the doctors are also aging. So there's a lot more drop-offs of doctors. So we're losing doctors as we get older. So a majority of doctors right now are older. Okay, and I don't mean to offend people by setting up an age, but let's just say 60 and over. Okay, so
okay.
the doctors are getting older just as the population is getting older, and as the population gets older, there's more demand for healthcare. So there's a lag, and even though there's been a steady amount of graduates, in fact, there's an 18.1 increase in medical matriculation and increase in applications for medical schools. It can't keep up. There's 155 medical schools. We're churning out these graduates, but we're also limited by the residency programs, which is limited also by government funding. So again, this is a very big cycle here. There's several layers to the problem. Now, COVID hit, okay? When COVID hit, it really put immense pressure. But even before that, with the Affordable Health Care Act, there was a increased pressure on physicians because here comes now mandatory electronic health records. There's been a mandatory reporting of outcomes, improvements in healthcare, which even though you report it, the bonuses that come in economically is small compared to the effort that you're putting in. And so and there's the economic burdens of buying electronic health medical record supplies, which are very, very expensive. And then here comes COVID. So there's reduced patient load, okay? Now you have to buy PPEs, okay? And you're not seeing any patients hardly. and then there's the increased stress of getting COVID yourself, okay, because you're in the front
Yeah.
lines. So depending on the surveys, there's so many surveys, 7.7% of physician practices closed with COVID, and 72% saw a reduction in their income. So with these factors leading to physician burnout, so with an aging
Mm.
population, decreasing supply of doctors, and increasing retirements, so we're expecting a shortage of doctors anywhere between 55,000 to 133,000 in 2033.
Wow, that is a huge number. Huge
And
number.
that's both
Wow.
and that's both primary care and specialty, and the differences will be bigger in different demographics, especially in the rural areas and the urban areas.
Wow. I now speechless on that. That really took blew me away. I have covered in this show
Mhm,
about generational differences in the workforce.
mhm.
Is there one when it comes to physicians? You kind of mentioned one, so I'd love for you to elaborate on that.
Okay. So of course I represent the older spectrum of physicians. And of course, when it comes to conversations like this, older people always say, oh, our music is better than yours. Oh, our fashion was better than yours. We were tougher doctors. We were able to work through longer hours, blah, 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 blah. Okay. But there's actually these are data, these are not perceptions. Okay.
Hmm.
Whereas the younger doctors, what they call millennial doctors, now more favor being employed rather than running their own businesses, because of these are their reasons, not mine. Okay, these are the reasons they've stated in surveys, is that they want to enjoy more work-life balance. They want more time. Number two, they don't see themselves as being doctors for life.
Okay.
Again, these are surveys, these are generalities.
Sure.
Okay. And what they've observed in some surveys was that older physicians tend to work more hours. So let's say I'm in
Hmm.
practice, I'm working 50 hours a week or 45, and they compare it to today's doctors, they work 40 to 45. A difference of 4 to 5 hours a week, multiply that by hundreds and thousands, there's 1 million doctors in the United States. So if you multiply that with a certain segment of a number of doctors, that's huge in terms
Yeah.
of hours that have been missed in healthcare. I'm not saying we just right or wrong, I'm just telling you the results of surveys.
Wow. Isn't that crazy? Think
Mhm.
about it. It's just a general and 5 minutes, 5 hours difference. Unbelievable.
5 hours
All
difference.
right, let's take a
Mhm.
yeah. Yeah. Go ahead. You were
What? No,
gonna say
no. I just
something.
said 5 hours of difference is huge. Okay.
Yeah. All right, let's take our quick break. When we come
Okay.
back, we're going to dig in more to this decision making stuff, okay? All right, I will be right back.
Just like a friend from back home. This is your Filipino radio experience in Las Vegas. PHLV Radio. PHLV Radio.
All right, welcome back. So now let's get to the nitty gritty of some of these questions. So,
Mhm.
Kuya, the next question that I have for you: can you tell us what are the pros and cons between opening private practice versus joining a medical group?
Okay, let's broaden the question. Okay, because now there's so many.
Okay.
Okay, so you're joining. Okay, you can establish your own solo practice, start it from foundation up. Okay, or you can join an established practice, or you can be what we call an employed physician, and we will discuss that further on. I mean, what does it mean to be an employed physician? In my time, it was very simple. You're an employee of the hospital, but that has morphed into a lot more options for doctors. So again, we went back to looking at your personality goal, your personality, your
Mm-hmm.
career goals, your salary goals. So if you are more of the entrepreneurial type, then you start off a private practice. The pros of a private practice is autonomy. That's the number one. Okay, nobody's telling you what to do. You can set your your schedule. You can set the culture in the office. You can choose the people you like. Okay, you will be able to be versed in different aspects of the business, and you have hands-on. You know your numbers. Okay, you're not dependent on anybody for that. Okay. So another aspect of private practice is that sometimes if you join a group and not start your own, they already have fixed assets, like for example, ambulatory surgical centers, and you can get equity from, not equity, but income from that. Okay, so if they own some fixed assets. Now, if you're joining a group and you can ascend, you can buy out the partner later on as you become a senior partner and as partners retire. So all of those, and lastly, there seems to be, they say, and I have experienced this, more personal interaction with patients because they're only going to be seeing you. Okay, it's just like the old model. Of, there's my doctor. You're walking down the street. Oh, that's my doctor. Okay, so there's more intimate care. So these are the advantages of private practice. Employed practice, okay, you have more growth in terms of you can go into administration, you can go into leadership roles, you can go into mentoring roles. So you have more avenues if you don't want to do the clinical aspects of medicine anymore. Secondly, you have a sound economic base. You have a good salary, and then there usually are incentives. You're incentivized. And then you have no administrative burden. You have potentially more vacation, actually almost always more vacation compared to private practice, unless you have a gigantic private practice group. Okay, so you have you have more vacation. And then again, in terms of less headache, you have actually less headache, and then you don't have to meddle with coming up with ways to make money or increase reimbursement, et cetera, et cetera. The disadvantages are you don't learn any of the other aspects of running the medical business. Okay, so that's a big disadvantage. Well, for some people, they don't really care much about that, but that is a disadvantage. Okay, and sometimes the goalposts of your bonuses could be switched at not at any time, but when the contract ends and you're up for renegotiations, then the contract terms could be, of course, mutually agreed upon. So these are some of the disadvantages of being in and of course you can establish your own culture, et cetera, and you lose autonomy. So those are the pros and cons.
So you touched a little bit on my next question, but I've read somewhere that it seems like opening up your own practice is declining in numbers, which obviously means more new doctors are joining medical practices. Right. I was going to ask you the disadvantages and advantages of that. Obviously, you touched on it. What are some other thoughts that you have with that, with that trend of more doctors joining medical practices?
Much was made about the recent survey by the AMA. Now, you have to understand there's 1 million doctors in the United States. Their survey involved 35,000 physicians. So we really cannot generalize this, but they can extrapolate the data. But for the first time since 2016, there's less than half of the doctors in this country are now employed. Are privately employed. So more of them now are joining bigger employment groups. As I said, I think the changes, the significant burdens and burnout and economic burden, administrative burden, lower reimbursements, and the regulations, dealing with regulatory affairs is really, I think, decreasing the number of doctors going into private practice. Now, there's pros and cons of this. There was a lively debate on this, but is it bad for the United States? When one says, yes, it's bad, because when you increase employment practices, then there's a higher cost, even though their goal is to decrease cost, but you're going to be seeing them in a facility. So if you're in the hospital, you're going to be paying a hospital facility fee to see the doctor. Whereas in private practice, you don't. So theoretically, you're going to be increasing cost, okay? And then none, of course, of that meaningful relationship that one has with their personal doctors. So again, there's debate on this. As it's like a big private corporation versus mom and pops, Okay, so
I hope you don't mind. I'll put you on the spot a little bit. I just want to ask you a quick question.
okay.
Do you miss it? I know you had your practice for over 20 years.
Now
Do you
you're
miss it?
putting me on the spot. I hope my employers are not watching me. Okay. Now, there's part of me, of course, that's 20 something years of my life. Are you kidding me? That was my baby. Okay. So I had
Yeah.
a very, very good relationship with my patients, with my staff. I love being the physician in my community where you go down the street and they see you. It's like, being, the sitcom Cheers, you come in and say, hey, Sam. Okay. Norm.
Yeah.
So,
Yeah.
get to know your doctors. But the advantages now that being here in Optum is that I don't really have that administrative burden. And I've been given an opportunity because in my position to be able to exert or be able to effect a change. And they're very nice in allowing me to do that, to effect change, which I'm hoping is for the positive, okay, establishing a culture of good service and following the goals which Optum has and augmenting it.
You're being humble. You're doing a great job. So, all right, let me ask you this. There are two sides that I see in healthcare that have changing trends. Can you tell us the changes that are happening in both the medical side and the practice side?
Oh my God, do you have an hour? Okay.
Okay, a slight one.
There's
Summary.
huge changes right now. There's a lot of trends going on right now in medicine, okay? Both in the establishment side and then in terms of healthcare. But one of the biggest drivers in change in care is the shift from sickness to prevention. That is huge. Okay. So emphasis is now being put on wellness, keeping the population well. And there have been economic rewards for this. There have been reimbursement systems are now shifting towards, rewarding people who are keeping people out of the hospitals and being sick more. So this is actually good news for primary care physicians because that's really been the emphasis. Secondly is the emphasis in outreach and access. So now we have telemedicine, okay? So this is huge because now we can reach people in the rural areas and then we can reach people who have limited time, the busy moms who have to pick up their kids, the working dads, everybody. So explosion in telemedicine is something that has really been exemplified and furthered by COVID, okay? Thirdly is the emphasis on data. Everything now is data driven. And we use data on a micro side. We use data from physicians. We monitor physicians. Their health parameters. And so now this is what we call genomics, metabolomics. So we use data to tailor fit. We use data and technology to tailor fit the medicine to the patient. So it's more precise medicine. And then we also use data in a macro scale to follow populations to see where we can cut costs. And the data also leads to newer forms of reimbursement, okay? What we call advanced payment models, okay? So we need that data so that the traditional fee-for-service can be switched into more of a value-based delivery of care. So I can go on and on and on, but the other thing is, for example, with the COVID, there's more emphasis now on behavioral health care because COVID has really brought forth us a whole set of problems in behavioral health.
Yeah.
So we need more behavioral health care services, which has really been, increased by the need has been increased by COVID because of our being isolated, et cetera, et cetera. And then, of course, there's industry consolidation. So there's a lot of changes there, which I will go into. And in the side of medicine, now it's so cool that we have what we call virtual reality and augmented reality. Virtual reality is you can practice surgery on a virtual person, or augmented reality, and that you can be doing actual surgery and you're being helped by technology, by robotics, by imaging, et cetera, et cetera. So there is a lot. And then, of course, there's cybersecurity because of all the technology that we're implementing. So again, as I said, I can go on and on about this. Now, on the establishment side, okay, now this is where there's a lot, Sonny, okay?
Okay.
Before, the only employer, other than private practice, right? You own your own practice, or you can join a big group, okay, or a small group. By the way, the trend is the groups are getting bigger and bigger. Okay, so now, like for example, I'm an allergist, and more like allergists are joining together to make bigger groups. Okay, now, but there's now non-traditional. So aside from the hospital buying out practices, and why do they buy out practices? They buy out practices for one thing, of course, to gain market share. Okay, have closer relationships with doctors, but also, of course, the bottom line is it increases income. Okay,
of course.
Now the doctors will be using the facilities of the hospital. That's been the traditional model. Okay, but now there's new models. The number one is now healthcare insurances are setting up their own, buying out physician practices, employing doctors. The biggest example of all that is our parent company. Okay, Optum. Optum is an outshoot of United Healthcare. It is now, so it's an insurer, right? Okay, and a healthcare agent, both. So it's now the biggest employer of doctors in the United States. By 2018, it was 50,000 doctors, and they bought DaVita Medical Center, which has hundreds of doctors and hundreds of clinics. And they continue to buy out physician practices, making it the single biggest employer of physicians in the country. So again, so that's not very traditional. So physician, now their goals are different from the hospital because they're the ones paying, right? Their insurances, okay? They want to they want to lower the cost by doing better managed care. They're managing the care better, and then managing the organization better and lowering the cost. That's one of their primary goals. And then of course they have, by doing so, they, in order to achieve that, they have to achieve increased patient experience, okay? And then increase, they have surveys where are you satisfied with our care? And then they will monitor the practices and make sure that there is decreased misutilization and wrong, overutilization and wrong utilization of care. Okay, the other group that's been buying out practices is private equity. Okay, so there's a law in the United States where private equity cannot buy out physician practices. So what they do is they have companies, or they have management companies. So they will manage the non-medical side of doctors' groups. Okay. So they will reduce the overhead of a physician. Will take care of your management. Will take care of your HR, etc.
Sure.
Contracting with the hospital for your services. Like, okay, so most hospitals will be contracting out anesthesia, emergency room services, sometimes neonatology, ICU care, and now they're branching out into dermatology, okay, and radiology. Okay, so that's another group, private equity, which is a little, more complicated because of the Stark laws and all that. Okay, or not really Stark. It is called a law called CPOM. Okay? I don't really know the legalities of that. So, and another group is physician organizations. So IPAs, independent physician practices. Okay, so what it is it's all about economies of scale. So basically, there are groups of practices, big doctor groups coming together. It's like Doctors Without Walls. Okay, and then that big group will be now able to negotiate for reimbursement better because it represents a bigger company. Then the most interesting to me, however, well, there's one more, which is people who are just centered on Medicare Advantage, like Kano, for example, Kano Health, because that is Medicare Advantage is like the biggest behemoth now in healthcare because as people get older. Okay, so there are now people who are groups which are now willing to take full risk. What does full risk mean? Okay, because we're now gone to the full value system of payment where I'm the group now who manages Medicare Advantage. I will tell you, okay, pay me this much per member per month, okay? And at the end of the year, okay, if I have money left over because I kept my patient healthy, then that money goes to me. So that's full risk. If the patient
Gotcha.
is sick, then of course you spend for it. So
Yes.
now, and then the thing that to me is very intriguing is employer groups. So 50% of Americans are covered under their employers groups, okay? Employer insurance. And 84% of these are fully funded. So let me give you two examples, three, okay? The biggest behemoth of all is Amazon, okay? Amazon now has walk-in neighborhood clinics within 10 miles of their employees, okay? So they work with, I think, Crossover Health, don't quote me on that one, okay? But they have clinics. So their concept is, we will manage our employees' care because we are the ones paying for it, and so we want to lower the cost. Okay,
Sure.
so now
I get it.
they have clinics within Amazon and within distance of their employees and their beneficiaries and their families, and they leverage their services because now there's Amazon Pharmacy, so it's so much easier for them to access medications. And you laugh at this because you can now schedule an appointment with using Alexa, okay, using their system. I'm not kidding you. So you can say, Alexa, schedule me an appointment with Dr. Vinuya on this date, okay?
Yeah.
Alexa will be able to do that, okay? And they've been able to parlay this into they're selling this practice actually. So they're actually telling other employers, okay, if you want to use our services, you can use it for a price. The other one is, the one who actually started all of this was Apple. Apple, same thing.
Apple,
same thing. They have their offices, their clinics for their employees and beneficiaries. Okay, manage. Of course, they contract with other physician services to manage it. And GM and Henry Ford in Detroit, where I'm from Michigan. So GM and Henry Ford have come. It's called Connected Care. Started in 2018, where Henry Ford Health System, not the Henry Ford car, but the Henry Ford Health System, will see the families and employees of GM personnel. Actually, they have preferential treatment. They can actually walk in an office, same day appointments. So again, so the world is, so if you're asking me now, okay, what are the choices? Private practice versus employment. It's not just a hospital. Employment means, look at all these models that you have. There you go. And I'm sure
oh my God, that is overwhelming. Very overwhelming. Okay. Last question, because unfortunately it's only a 30-minute show. You definitely need to come back.
Okay.
What would be your best advice to a young doctor deciding?
Whoa, that's going to be so hard because, as I said, now here are the complexities I've already told you. But as I said, you have to do it to yourself. Well, you have to be really look at yourself in the mirror and say, what do I want? What am I capable of? What I'm willing to tackle? That's the most important.
Okay.
It would be nice, like, okay, if I were from the Philippines and I were newly, I come here, all I do is I'm coming here, I do residency and I'm overwhelmed, and I come out of residency and I don't know anything. It would be nice to have resources, but we don't really have resources for this, for people to explain this, okay? So I can just imagine myself explaining to my younger me in a mirror, and I'd probably be like, whoa, you know what I mean? So it would be nice to have resources for that. And
for the audience, just to let you know, there's one. It's called the Nevada AAPI Business Advisors. They're working on that. So yeah, definitely. But keep on going.
This is very, very much needed, Sonny, because another area or another niche where there's needed is like, we're all getting older. I'll speak for myself. I'm much older than you. But when we reach a point now that, okay, when this statement comes like, okay, here come your Medicare benefits, and then here are your choices on your insurances. You know how overwhelming that is? Okay, so it would be nice. Okay, there are groups of people, there are already groups of people who are willing to explain this to you in different healthcare organizations, because of course they're hoping to get your business. Okay, but it would be nice if there were some independent groups or even ethnicity-based groups, because they can speak in language, okay, in the native language, to explain the complexities of Medicare and what kind of coverage do you need? What is Medicare A, B, C, D? You know what I mean? So
yeah.
So if the
independent group, I like that. All right. Thank you so much for joining us. Unfortunately, we have to end the show. It's a 30-minute show, but you got to come back definitely because there's more to talk about, especially with these trends. But thank you for joining us. I really appreciate it. And yeah, good night. That's our show for tonight. Take care.
Okay, bye.